Hello, you're watching The Wire. Today is March 28th, and this is the daily COVID-19 updates bulletin. As of Saturday evening, 819 people in India were infected with the new coronavirus, according to the Ministry of Health and Family Welfare. 79 people have recovered, 19 have died, and 1 has migrated so far. 177 people have been affected in Maharashtra and 168 in Kerala. Globally, over 600,000 people have been affected by the pandemic in over 170 countries. In the US alone, over 100,000 people have contracted the virus so far. The count in US is now more than that of China and Italy. Hundreds and thousands of Indians gathered at the Anand Vihar bus depot in the morning today to catch a bus home. These were largely migrant daily wage workers who, in the absence of any work or money, want to go home. On the 4th day of the lockdown, a large gathering of people in the capital city, where over 30 people have contracted the disease so far, has defeated the purpose of a lockdown or social distancing. Some have taken to social media to blame the mismanagement of poor populations of India on the central and state governments. On Saturday, reports poured in from across the country on the shortage of medical equipment for doctors at some places and a shortage of medicines at chemist shops. The shortage of medicines was reported due to disruptions in the supply chain because of the lockdown. The president of All India Organization of Chemists and Druggists told the Economic Times that if bottlenecks in supply chains are not sorted out soon, then retailers will run out of all supplies in the next 4 to 5 days. Medical store owners in Punjab's Ludhiana told state media agency ANI that their stock of medicines is almost exhausted. As reported by The Wire yesterday, acute shortage of personal protective equipment was seen at 2 municipal corporation hospitals in Kalyan's Dombivli in Maharashtra, where the maximum number of people have contracted COVID-19 so far. In Punjab too, according to a report published by an independent journalist Prabjeet Singh, at a district civil hospital in Bhatinda, medical teams had been washing their hands with country liquor before a consignment of sanitizers arrived today. The Resident Doctors Association of Punjab issued a notice yesterday saying that they are working in conditions that provide absolutely no protection against contracting the virus. There are no masks, gloves, or sanitizers available, let alone personal protection equipment kits for those working in emergency wards. A mathematical model prepared by the ICMR scientists almost 2 months ago suggested that simply isolating symptomatic international air passengers could not have delayed the COVID-19 epidemic in India, because these screenings wouldn't capture infectious people who were not yet showing symptoms of the disease. When Priyanka Pula, a science writer for The Wire, asked ICMR why it waited so long to widen community testing despite its own model suggesting otherwise, the paper's co-author said that logistical constraints played a part. By ICMR's own admission, however, India had ample capacity to conduct COVID-19 tests, so a shortage was not the cause of slow ramp-up. Another co-author of the paper has previously said that ICMR was only using 10% of its testing capacity. The reason it was not expanding tests further was because there was no evidence of community transmission with them. This evidence was based on negative test results of 500 samples, which experts have called completely inadequate for a country of over 1.3 billion people. Kerala, which has the second largest number of people infected with the novel coronavirus, recorded its first death today. The Kerala government has been appreciated for managing the crisis in the state, which includes delivering relief packages and food grains to the poor. The coronavirus first hit the state in January, and since then over 11 people have been recovered. That's all for today. Thank you for watching. Keep reading thewire.in. I will see you on Monday. Until then, stay safe.